Could you be a carrier of the hepatitis C virus without knowing it? More than half of the people affected by hepatitis C don't even know it. Anyone can get hepatitis C if they are exposed to the virus. So yes, you can have hepatitis C without knowing it, and without showing symptoms. Hepatitis C is a liver disease that is caused by the hepatitis C virus. You can carry the hepatitis C virus for many years without having any symptoms or feeling sick, while the virus damages your liver. Rest assured, an easy and complete cure is now possible following diagnosis with a simple blood test. Symptoms may appear anytime within a few weeks, months, or years following infection with the virus. The main symptoms are fatigue, loss of appetite, nausea and vomiting, stomach pain, fever, diarrhea, yellow skin and whites of the eyes, jaundice, pale stools, and dark urine. Joint pain. If left untreated, hepatitis C can lead to serious complications such as cirrhosis of the liver, or liver cancer, which can be fatal. Unlike hepatitis A and B, there is no vaccine against hepatitis C. How is hepatitis C transmitted? Hepatitis C is transmitted through contact with contaminated blood or bodily fluids, such as semen or vaginal secretions. The virus can be transmitted through sharing materials or objects soiled with infected blood, receiving personal care or services using tools contaminated with infected blood, receiving an organ transplant or a transfusion of infected blood or blood products, sexual intercourse creating lesions, or in the presence of infected blood, pregnancy or childbirth, as well as breastfeeding. If the breasts bleed, an infected mother can transmit the virus to her child. Immigrants or newcomers may have contracted hepatitis C in a medical context, through the use of equipment that was not properly sterilized, such as a syringe, or during a transfusion of untested blood or blood products. Cultural practices such as shaving in the community, hair salons, aesthetic services, and manicures are other possible forms of transmission, as are traditional medicine practices such as acupuncture if needles are reused. The hepatitis C test is not part of the routine medical examinations required to immigrate to Canada. Tattooing and piercing practices can also carry the risk of contracting hepatitis C if the environment and equipment are not properly sterilized. The hepatitis C virus can survive for a long time outside of the human body, and it is not necessary for there to be visible blood on the material for it to cause infection. The only way to know if you have hepatitis C is to get tested. Today, this can be done with fast and simple blood tests. Hepatitis C can be cured, highly effective treatments exist, and they are covered by your province's medical insurance program. Ask your doctor for this free test today. For more information, contact the Alliance of Cultural Communities for Equality in Health and Social Services, ACCESS, by accessing their website, www.access.net.